Good morning, and I would like to thank the academies for giving me a chance to discuss our project. Can you all hear me? Okay, so when the slides come up, I want to tell you a little bit about our Stella initiative, Smart Technologies for Extending Lives with Linear Accelerators, and actually been hearing a lot about collaboration, disparities, innovation, use of AI, and I want to tell you a little bit about radiation therapy, which is the bread and butter of cancer treatment, 50% of the patients for curative treatment and pain relief, and also what we are doing in terms of this improving access radiation therapy globally. I mean, all this really, started with the world map that came from IAEA and DIRAC in 2012, showing huge disparities in global access. And then Estro and Hero did their study in Western Europe in 2013. And then, of course, you've been hearing about the Global Task Force on Radiation Therapy, where they showed not only the importance of radiation therapy for patient treatment and access, but also economic sense, that it made a lot of sense. However, in spite of all of these, so this was the very first study that came out. You could see on the map part of the world which are green, and unfortunately lots of areas which don't have access, and Africa is always, and Sub-Sahara in particular, is always big in the challenges, and that was in 2012. And then last year in September, we had the follow-up Lancet Oncology Commission, and you will see, unfortunately, the challenges still exist. We haven't really moved the needle that much. We can talk about hyperfractionation, we can talk about new markers, we can talk about this, but the access to the life-saving radiation therapy, which is recommended for about 50% of the patients, is still a big challenge. And you've heard already this: inadequate supply of radiation therapy, inadequate supply of imaging, inadequate supply of experts. The gap is the greatest in LMICs, and in LICs, only 10% have access to this precious treatment. And so I tell you where Stella started. We've talked about collaboration, and CERN is, the home of physics, but we are 3,000 people, but our collaboration is about 20,000 people around the world, and we really believe in collaborating globally to look at the latest technologies, brainstorming, and so on. In 2014, which was the start of Stella, Ugo Amaldi, who's 90 this year, but he talked about physics is not only beautiful, but also useful. And Norm Coleman, unfortunately, who passed away last year from NCI, talked about the vision of his NGO, the International Cancer Expert Corps, and how we improve access. And this was really the birth of Stella. And in 2016, we had the first workshop saying, what are the design characteristics of a new machine that would try to overcome these disparities? And as usual, bringing all the partners together in the room, collaborating, discussing, and thinking up strategies. And for the next 3 or 4 years, we built a collaboration, defining a strategy, but also involving everybody, especially the grassroots, where the challenges are and where they need to decide which of the solutions are, and not just sitting here and thinking, oh, we know. I mean, as I said, I've been hearing amazing things, but trying to translate into reality is a long way there, and for that, you really need all of your stakeholders. And so the Stella collaboration, as I said, is bringing a large collaboration together. I said, Ravi, of course, we are open to all of the people, and I discussed yesterday, and we would like that to be as global as possible, is expanding access to high-quality cancer treatment, developing innovative solutions, driving down the cost, and of course, machines don't treat patients, people do, so you have to educate and train in parallel. And the reality of the machines are that we've heard the numbers. IAEA recommends you need about 5 or 6 machines for 1 million people. We are a population of 8 billion. There are 15,000 machines. So you can see that there's a huge lack, okay? And so how do we try to increase this access? And we started with Africa because it was the continent which had the biggest challenges. It's a continent of 1.4 billion people, and it has 400 machines. And just as an example, in the US, it's a population of 340 million with 4,000 machines. Okay? So there's huge disparities. And even within Africa, 3 of the countries have 60% of all of these machines. So how do we try to move the needle? And you know, we've heard about the importance of data. So what we decided to do was we needed to understand how the current situation is, and so we looked at every single country in Africa that had radiation therapy, asking them what works, what doesn't work, what could be improved, and how do we move forward. And in order to compare this, we also looked at high-end countries in our collaboration, US, Canada, Switzerland, and the UK. And what we found was, of course, surprise, that if you have a large GNP and you have access to Linux, the cancer mortality, of course, is much lower in high-income countries. But what really shocked us is that not only these countries don't have machines, but their machines are down all the time. So you have very few machines and they're not working. So then we looked at to see what is it that goes down, which are the biggest challenges. Amazingly, the biggest challenge was access to spare parts. They can't afford them. They're too expensive, and they can't afford service contracts. And in order to get a spare part, and we were having a discussion yesterday in Africa, has to go through South Africa. You pay the tariffs, then you go to the other country, you pay the tariffs, and by the time you get the spare part, it's a really long time. In Madagascar, the machine was down for more than half a year because they couldn't have that. So what we are looking at is seeing the design and what the challenges were. How can we start looking about making a novel machine which is low cost, hopefully, but robust, multimodality, easier to fix so that you don't need experts, and they don't break down so much. And one of the biggest challenges, and Ravi, you mentioned that, is the MLC, the multi-leaf collimator. We're doing a lot of work on the multi-leaf collimator to make it simpler, but still have the same conformality, because it's been over-engineered for our high-income countries. So, this is the sort of thing we are looking at. And, and AI has been mentioned a lot. So besides having a state-of-the-art technology, which is simple, robust, and modular, is can we use AI and machine learning to help us to make the machines smarter, faster, and cheaper? So we have 3 really smart young people, and one of them is looking at how to do predictive maintenance. So before the machines break down, because I said the challenges with spare parts, so how to try to see what's going to break down before it breaks down. Look at the downtime, the service contracts, and then we have Doris from Cambridge, who is looking to see if we can use intelligent-based segmentation for predicting how to do the treatment plans by going rather than autonomous. So of course you will have a last check-in with the expert, but you save anything from 5 minutes to 3 hours or 4 hours, depending on how sophisticated your imaging is. And then we have Violetta, who is looking at all the radiation therapy plans which we have access to, fortunately, to try to see if we can combine all of these and try to move to be able to all, using federated databases, access to all of this. So really the use of AI in trying to make faster decisions with fewer experts and give state-of-the-art treatment. So our Stella is a vehicle for leveling access to radiation therapy. As I said, local radiotherapy provision. And I'll show you the next slide, is that we are talking about cancer centers, we are talking about big cities, but the thing is, our patients live everywhere. So how do you make sure that patients globally can have access? And as I said, I was going to say in the US, because we are also looking at the US. US has the highest number of Linux, has excellent healthcare, and yet 40% of the patients in the US and rural regions don't have access to radiation therapy. And so how do you overcome that? So the idea of local radiotherapy provision, lower staff footprint, because staff is very expensive, especially in high-income countries. In low-income countries, they don't have experts, so you have to deal with both of these challenges. And as I said, greater uptime using predictive and preventative machine learning, high-quality imaging, hyperfractionation, so in order to improve access, networked and data-driven, and really increased trained experts leveraging AI and virtual learning tools. And I just wanted to show, I mean, US, of course, is a big country, and a lot of other countries, we're talking about India and Pakistan and so on. UK is a small country. This was a really powerful study that came out last year. Even within the UK, a large percentage of the people, they have to, not everybody has a car, 1 hour distance, 45 minutes distance. If you talk about 4 or 5 weeks of treatment, patients don't want to have to deal with that. It's really challenging for them. And unfortunately, our public transport is not the best. So, we have all of these challenges. And the only thing I would say is we've done a number of these studies. We started with Africa. We've looked at the Balkans. We've looked at former Soviet Union countries. And all of these have very, very similar challenges. So I think the solutions we try to come up with will address a large majority of the challenges we have. So just wanted to just give you an idea of the fact that, yes, we need wonderful technologies, we need experts, we need access, and we need to use AI in also to make this provision as globally as possible. So thank you.